Hello everyone, my name is Nancy Centeno, and today I want to talk to you about North Bay Hospital, where I'm currently doing my practicum. And I want to take the time to reach out to any potential clients or any family members that are interested in what is called Mitchell Rehabilitation Hospital. It's actually located in North Bay Hospital, and the mission of this program or facility is to improve the health of all that they serve through community-owned healthcare services and set the standard for high-quality, compassionate care. Mitchell Rehabilitation Center, like I mentioned, is inside North Bay Hospital, and some days while I'm doing my practicum, I help assist any psychiatric needs, assessments of the patient, any speech, language pathologist services, psychology notes that I can supervise. That I observe through my supervision, through my supervisor. And I want to talk about how the program provides so many services to the patients, and it also provides services to family members, and it's a great rehabilitation program that's inside the hospital. And one of the features that is a lot of people enjoy is the fact that it's inside the hospital, because a lot of doctors work alongside any services that you have already gained in the hospital, or even if you're coming from outside the hospital, you have a lot of hospital care, a lot of nurse care, a lot of therapy care that goes into the Mitchell Rehabilitation Center. Some of the criteria to be admitted is being 18 years of age or older with medical necessity for inpatient rehabilitation. Patient requires close supervision of physician to manage medical conditions. Patient has reasonable expectations for functioning gains. There is a reasonable expectation that the patient will return home or to assisted living facility following the course of inpatient rehabilitation. Admission based on bed available for 20 bed units. Patient must have the potential of participating in 3 to 5 hours of therapy per day, 5 days a week. Patients must have the need for rehabilitation nursing 24 hours a day, 7 days a week, and patient must require at least 2 interdisciplinary therapies. Patient must not be on ventilators or respiratory dependent, and patients admitting must have diagnostics appropriate for inpatient rehabilitation programs. And started in 1987, Mitchell Rehabilitation Hospital and Morton Plan Hospital is a 20-bed unit accredited by the Commission of Accreditation of Rehabilitation Facilities. In addition, Morton Plan North Bay Hospital is a Joint Commissionary Primary Stroke Center. Both designations assure patients that they are being cared for at the facilities that meets the highest quality standards. There's a lot of clinicians, a lot of psychologists, a lot of physical therapists that are on standby for the Mitchell Rehabilitation Center. Again, it's inside a hospital, and the way that a patient may be able to be able to part of the services or be able to be admitted is by contacting social services team, and which can be reached by calling the 727 number that is located on the website or even in the hospital. And social services team works hand in hand with the Mitchell Rehabilitation Center and provides quality care for the patients, making sure that the patients have somebody by their sides. A lot of the professionals who care during the stay of the patients include psychiatrists, or doctors who specialize in behavioral health, hospitalists, which are doctors who specialize in rehabilitation, physical therapists, occupational therapists, speech language pathologists, recreational therapists, rehabilitation nurses, psychologists, like I mentioned, dietitians, and chaplain services. A lot of the daily activities that the patients will have on like a regular basis would be participating in 3 to 5 hours of therapy each day. Breakfast is served in the morning, and in the morning they will begin the occupational therapy, assisting. The occupational therapy will be assisting activities like that will help the daily living, which would help with grooming or dressing, etc. Then we'll follow with therapists, physical therapists, occupational therapists, recreational therapists, and or speech therapists. Even a psychologist will come in and speak to you to make sure your mental state's okay. If anybody was admitted through behavioral mental concerns, they would also go ahead and speak to you. The quality of care for the patients in Mitchell Rehabilitation Center is the number one priority for the hospital, and also North Bay Hospital, again, because Mitchell Hospital is inside North Bay Hospital, so they work hand in hand to make sure the patients are okay and are treated with quality care. And again, any concerns or anything, the family members are there, the doctors are there, the nurses are there to help this patient, be able to make their goal of their healing process when it comes to either physical, behavioral, mental state. Mitchell Rehabilitation Center is a great facility for anybody who's interested in with their family members, or even somebody who's in the hospital and needs those assistance. So I hope this video was informative, and I hope you enjoyed. Thank you.